السلام عليكم ورحمة الله وبركاته. النهاردة إن شاء الله هنتكلم عن المنتل هيلث versus mental illness by Dr Wafaa Osman, Head of Psychiatric-Mental Nurse Department, Faculty of Nursing, Helwan University. Mental health actually is the important subject. It is important for everyone because it is a touch for the scientific area. So today we will know everything about mental health and mental illness, that is containing the objective, like our objective at the end of this lecture. Each student should be able to discuss the parameters of mental health and mental illness. يعني احنا هنعرف ايه عن ازاي اقدر افرق ان ده individual healthy toward mental health ولا هذا mental illness. كمان هنعرف define the mental health and mental illness as scientific definition, describe the component of mental health. ايه هي هنلاقي عندنا 7 components بيها اعرف ان دي component of mental health for healthy mental person. Identify factors influencing mental health. أكيد في factors influencing mental health condition that is lead to positive health from the word of mental, or it is lead to mental illness. Differentiate between the general characteristic of mental health and mental illness، لأن كل حاجة بتبقى لها الكاركترستيك وليها الكرايتيريا اللي اقول بيها ان دي character for mental illness or mental illness. Practices that decrease the mental health. ايه الممارسات اللي نقدر بيها نزود المنتل هيلث، وايه ممكن احنا بنعمله practices that increase the mental health. كمان هنتعرف على diagnostic and statistical manual of mental disorders. Finally we will discuss psychiatric mental health nursing scope and standards of practice. First, what is the definition of mental health? The Health World Organizations defined health as health separate. Now we discussing about health as a general, not focusing on mental health. Health as general defined as a state of complete physical, mental, and social well-being, not merely the absence of disease or infertility. That is mean person I say this is healthy person in the general condition when I find there is combination or integration between the physical domain and the mental and the social well-being, not merely absence of disease or infirmity. But the definitions of mental health is a state of emotional, psychological, and social well-being or wellness, evidenced by satisfy interpersonal relationship, effective behavior, and coping, positive self-concept, and emotionally stability. It is meaning mental health. What are the components of mental health? As we see, there is 7 components of mental health. That is beginning with self-governance. What is meaning of this? Meaning the person demonstrate autonomy. The person can do everything for herself or help other by himself. The person have autonomy, so he can thinking in the situation, he can analyze the situation, also he can find the solution for situation. Maybe in some time this person need help from others and asking for help, it's okay. And when I asking for the help, it is one of criteria I am completely aware I need help, so I take this step by myself and asking the help from others. Second component, growth orientation, progress toward self-realization, maximizations of capacity. Growth orientations like physical growth and development, when you born every day and you pass with the different growth and development in the physical domain. In the psychological domain, you need to increase your orientation, your capacity, your ability. So it is needed to progress from the time to the time. Why? Because when the person facing certain problem or need to taking decisions or need the increase his ability or update himself and so on, needed to growth orientation to help themselves taking action toward the maximize capacity and ability. 3 point of component of mental health: tolerance of uncertainty. What is meaning of tolerance of uncertainty? The person faces the uncertainty of living. Each one of us maybe face certain situation suddenly, and he in some time can't deal with this situation. But when he has the growth orientation and has past experience, or he has the criteria of self-governance, he can deal with uncertainty situation. So it is one of the component of mental health. Also from the component of mental health, self-esteem. Self-esteem meaning built on self-knowledge. Increase your knowledge all over your life, and awareness of talents. If you aware with your talents and you develop it or no. And self-esteem increased by increased ability, and you know what is your ability, what is your limitation, what is your strength point, and needed to increase what is the weakness point in your personality and wanted to change to strength point, and so on. 5 components of mental health. Mastery of environment. What is meaning of mastery of environment? Capable and competent and creative in dealing with the influencing the environment. Each one of us passes with different stage and situations all over the life. So you need to deal with of these situations. You should have creativity in your thinking, creativity and component in your attitude and the behavior to deal with these situations, because everything in your environment affect on you, and you should be affect in these factors. So master environment, you the leader in your environment, and you able to lead the situations that facing in your life. 6th component, reality orientation. That is meaning you able to distinguish between the reality and the fantasy. You should be distinguish between what is wrong and what is right. You distinguish between the different options for solutions and select the suitable one of this. 7 components, stress management, and it is very important component, and we will be discuss this point in details in the next lecture inshallah. Stress management, when you use the stress management, you can gain more experience and ways to deal with different situations, and we will discuss all stress management in detail in the next lecture. Now we will discuss what is the factor influencing mental health. We found 3 factors influencing mental health. That is varying between hereditary factors or characteristic, nurturing during childhood, life circumstances. Heredity or inheritance characteristic, it is factors that may be affected in mental health. For example, if in certain family has psychiatric patients, one of member in this family suffering from mental illness. When I asked mental illness or psychiatric illness is the hereditary disease, yes, there is percentage of hereditary disease that is vary from sibling or between mother and father and the other generation in this family. So take precautions when find the family has psychiatric illness. You should be take precautions to avoidance the marriage from this family with the relative, because the psychiatric illness one of the hereditary disease. Number 2 from factors influencing mental health, nurturing during childhood. In the ways of nurturing your child acquired different behavior around him from the first days in his life and with the growth development in the all time of age. Like, for example, if the mother very violent and his behavior aggressive in the different situations, with the days this child will learn to deal with other with violent behavior. It is important to know violence behavior is acquired behavior. Anyone don't born with violence behavior. So it is very important this mother learning to how deal with the aggression behavior and how learn to manage stress and how learn how to manage her anger way in dealing with the situations, because it affect on the childhood and all child in this time. Also from the nurturing during childhood, ways of communication between father and mother that is affected in the child behavior and the mood of the child, and ways to deal with their friends and siblings and so on. All situations in our life effective in our feeling and thinking and our behavior. Third, factors influencing mental health, life circumstances. Life circumstances include several things like include success in the school, financial security or there is financial problem, good physical health or successful marriage, the ways dealing with themselves in the general health, the ways of lifestyle is healthy or unhealthy. It is life circumstances situation all over our life, and these 3 factors affect the mental health states. So you should be take precaution towards these 3 factors. Now we discuss the general characteristics of mental health individual. Now if you check yourself and check the point you have from the characteristic of mental health or no. Mental health is able to work well alone and with team, with other, in the group. Also, mentally health is accepts responsibility for his action and several tasks and different role in his life. Mentally health is able to give and receive. No one in this life can live with the life take all time every time, take all everything all time, or he give everything for all for a time without any receiving for himself. It is unhealthy. So should be able to give and receive. Mental health is optimistic. Mental health is express feeling. In this point, able to express feeling, we should take attention about the ways to express the feeling and who can express the feeling in easy way and who can't express feeling. According anatomy of male and female, the female, according her anatomy, brain anatomy, can express feeling by easy way because it is structured anatomically to do that. But the male, it is difficult to express feeling, but he can learn how to express feeling. Mental health also able to solve problems in his life, able to benefit from rest and sleep, because rest and sleep, it is from the physiological need in the Maslow hierarchy need. It is the first motivational level of Maslow human needs. Mental health also can recognize limitation. The mentally health person should know his ability, to what extent, and what is the deficiency, and how he can change the deficiency or weak point to strength point. It is important to increase self-awareness. Mental health also, from the characteristic, is able to form meaningful relationship on the social level, on the personal level, intimate level, in public levels. He able to form meaningful relationship on the different levels. Also, he is able to make sound judgment and decision. Able to, or mentally health is, can take care of his hygiene and clothes in manner which conforms to the standards of his society. Also, mentally health is able to cope successfully with stress. That is mean a person can return to normal function if temporarily disturbance. Mental health also able to distinguish facts from fantasy, or the real world from the dream. Now we will discuss another part, or the verses of mental health, that is mental illness. The American Psychiatric Association defines the mental disorder as a clinically significant behavior or psychological syndrome or pattern that occur in an individual and that is associated with present distress, painful symptoms, or disability, impaired in one or more important areas of functioning, or with significantly increased risk of suffering death, pain, disability, or important loss of freedom. Or mental disorder we can define with another definition, that mental disorder or health condition characterized by alterations in thinking, mood, or behavior. They are associated with distress or impaired function. Observe in this point what is meaning the alteration of thinking, mood, behavior. The component of brain will be discussed in another lecture. Component of the brain contains 3 components, should be integrated each one to the other: thinking, mood, and behavior. And each one of them should be completed with the 2 parts to give the healthy criteria of the healthy person. So any alternation in one of more of these parties, thinking or mood or behavior, one of them or two or more, it is lead to distress or impaired function that lead to mental illness. What is the general criteria of or characteristic for or to diagnose individual with mental disorder? Includes, not, observe with me, not one of these criteria that is mean mental illness, but any disorders to diagnose mental illness should be contain the more than 1 or 3 or 4. That is mean the diagnosis to say it is mental disorder should be containing collection of symptoms that's divided between positive symptoms and negative symptoms to help you to say this is mental disorder. That is mean diagnosis for mental disorder need collection of symptoms, not one symptoms only. From this criteria, when an individual is not able to review himself clearly, feels inadequacy, or has a distorted view of self, has poor self-concept and dissatisfaction with one's characteristics, ability, and accomplishment. Number 2, the person is unable to maintain satisfied personal relationships and unable to cope and exhibits maladaptive behavior and dissatisfied with one's place in the world. 3, displays poor judgment. He can give judgment in the situation or toward a certain problem or toward anyone taking his opinion. So he becomes displayed poor judgment. 4, ineffective coping with life events. He can face any situation to deal with it. He can to solve a problem with uncertainty time. 5, lack of personal growth on the level of psychological growth. As you remember the growth orientation, he can't to develop himself or increase his experience, update himself or increase capability, or he can deal with the talent and improve it, and so on. What else? 6, unable to accept responsibility for actions. When he do certain actions, he say, I don't know. No, it is not my responsibility. So he is escaping from responsibility and his tasks. Also, number 7 is pessimistic. He in several times sense of hopelessness. He usually say it is impossible to happen. He has negative thinking, negative way to deal with other, so he is pessimistic. 8, doesn't recognize limitation. What is his abilities or deficiency? He can't determine or he can't recognize or point to this point. 9, exhibits dependency needs because of feeling of inadequacy. 10, is unable to perceive reality. He live in fantasy. He live in dream. He maybe imagine certain aim, maybe he can't reach to it. So he all the time live in the fantasy. 11, doesn't recognize potential and talent because of poor self-concept. He see himself as the little one. He see himself the low in level between all people around. 12. Avoid problems rather than coping with them. 13. When his behavior is deviated sufficiently from normal to indicate disorganization of the self, and we consider this person is mentally ill. We can find some signs and symptoms. For example, not to make diagnosis, possible signs and symptoms of mental illness like what? Marked personality changed over times. You observe the person begin to change in the personal characteristic or ways or behavior or in the attitude or in the relationship and so on. Also, confused thinking as grandiose idea. He have certain idea and logic. Also, prolonged severe depression and sad moods and apathy. Excessive anxiety, fear of suspiciousness, blaming others over the time. Also, he may be withdrawal from society, friendlessness, abnormal self-center. Also, thinking or talking about suicide because he's suffering from depression symptoms. Denial or obvious problem, strong resistance to help. Numerous unexplained physical alignments. Also, you may find the marked changes in eating or sleeping pattern. Towards the behavior, maybe find anger or hostility out of proportions to the situations. Also, delusions. What is meaning of delusions? False beliefs that are firmly maintained even though they aren't shared by others. Delusion, it is false, fixed idea or feeling or belief with this person. Abuse of alcohol or drug. Why he go to this point or he do this point? Because he need to escape from reality, and he also unable to solve the problem facing. Also, maybe found hallucination. What is meaning of hallucination? Disturbance of perceptual distortions arising from any of the senses, like hearing voices or seeing images that others don't hear or see. Growing inability to cope with problems and the daily activities as school, job or personal need. He's escaping from of this because he is unable to responsible for anything. What is practice? Practices that decrease the mental health. Practices that decrease the mental health are overeating, eating cooked food. Also, improper food eating causes depression, anger, fear, instability, and anxiety, and the other form of emotional dysfunction. The brain and the body are nutritionally interrelated and interdependent. Also, deficiency in several types of vitamins like vitamin A, vitamin 1, B1 or B3, B6. It is important vitamin for the neurological conditions and the healthy neuron in the body. And vitamin C or calcium and magnesium causes mental illness. Mental illness can be caused by chemical imbalances in brain by the transfer of drugs across placental barrier or by organic changes within the brain. If the person is unsuccessful in dealing with environmental stress, poor nurturing during childhood or negative life circumstances. You remember with me, it is 3 factors that is affecting mental health. You remember that or no? Yes. What else? We will discuss practices that increase mental health. First one, fasting and eating sparingly, eating raw fruits and vegetable diet. Fast and or eat a proper diet will not have any negative emotions. Also, obtaining sufficient sleep, it is very important because sleep, it is the one of important physiological need for the human. And do meditations, being aware, vigorous exercise, receiving adequate sunshine, in taking fresh air, being free of toxin, daily mental exercise, self-confidence and self-mastery, mastery for environment and all situation you face. If you are nervous, depressed, phobic, neurotic or psychotic, to feel better and to get well, close your eyes and keep them closed every moment you can. Closing the eyes rests the brain and the mind. It is very important point. And in the lecture of stress management, we will discuss this point in detail and have the technique to do that. Also, taking moderate physical activities and exercise. Nervous energy is used up by physical activity. Also, nobody can make you mentally ill with their verbal abuse to you. No. One can take advantage of you without your permission. Nothing can bother you unless you let it. Self-control is the great law of mental health. Now we will discuss what is the diagnostic and statistical manual of mental disorder. All psychiatric disorder or mental disorder divided to the 5 levels of disorder according to diagnostic and statistical manual of mental disorder. Axis 1 is for identifying all major psychiatric disorder except the mental retardations and personality disorders. Examples of axis 1 like depression, schizophrenia, anxiety, and substance related disorders, that is mean substance abuse. That is mean these disorders included in or involved in axis 1 to diagnose the mental illness. Axis 2 is for reporting mental retardation and to diagnose personality disorder as well as a prominent maladaptive personality feature and defense mechanism. Axis 3 diagnosis what is for reporting current medical conditions that are potentially relevant to understanding or managing the person's mental disorder, as well as medical conditions that might contribute to understanding the personnel as diabetes mellitus. That is mean axis 3 diagnoses the condition of physical disorders plus the person having disturbance in psychological issues. Axis 4 is for reporting psychosocial and environmental problem. Axis 4 diagnoses psychosocial and environmental problem that may affect the diagnosis, treatment, and prognosis of mental disorders. Include example for this psychosocial environmental problem or problem with primary support group, social environment, education or occupations problem, housing problem, economic access to health care, and legal system. Axis 5, it presents the global assessment of function. It is a scale. This is scale to measure which rates the person overall psychological function on the scale. This scale is divided from 0 to 100. That is, this represented the clinician's assessment of the person's current level of function. When you decrease to the 0 point, it is meaning there is low level of function. When you raising to arrive to the 100, it is meaning this person has a high level of function. Also may giving a score for barrier functioning. For instance, highest GAF, Global Assessment of Functioning, in past year or GAF 6 months ago. This you can check on your functioning every 6 months or 1 year. Now we will discuss the point about psychiatric mental health nursing. In a rapid idea, psychiatric mental health nursing is an integral part of the continuum of nursing practice. The American Nurse Association describes psychiatric mental health nursing as a specialized area of nursing practice that employs theories of human behavior as it is science and the purposeful use of self as it is art. It is the diagnosis and treatment of human responses to actual or potential mental disorder and their long-term effect. Intervention includes the continuous and comprehensive primary health care services necessary for the promotion of optimal health, the prevention of mental health, also rehabilitation from mental disorder, and the maintenance the level of mental health. Psychiatric mental health nursing scope is divided to two very big branches, that is standards on the practice. What is the subtitle under the practice? Standard 1, the nurse should be made complete assessment by collecting comprehensive health data that is pertained to the patient's health or situation. Standard 2, diagnosis, the psychiatric mental health nursing, registered nursing, analysis the assessment of data collected before and to determine diagnosis of the problem and set it in the priority, including level of risk, according level of risk. Standard 3, outcomes identification. The psychiatric mental health registered nurse identifies expected outcome for a plan individualized to the patients or the situation. Standard 4, planning should be both planning for this mentioned problem for the patients or need to serve the care for the patients. Psychiatric mental health registered nurse develop a plan that prescribes strategies and alternative to attain expected outcome. Standard 5, implementation. The psychiatric mental health registered nurse implements the identified plan. Standard 5A, coordination of care. The nurse coordinate care delivered with the other team or other department in the hospital to provide the care for the patients and to improve the condition for the highest level of mental health. Standard 5B, health teaching and health promotion. It is very important point because health teaching helping in health promotions and maintenance for the health, because health teaching add in the knowledge and increase awareness for the patient and the family about the health condition and how to maintain this health condition and how deal with any problem may be facing and so on. Standard 5C, Milieu Therapy. Milieu Therapy meaning provides structures and maintains a safe and therapeutic environment in collaborations with patients, family, and other healthcare clinicians. Standard 5D pharmacological, biological, and integrative therapies. Psychiatric mental health registered nurse incorporates knowledge of pharmacological, biological, and complementary interventions with applied clinical skills to restore the patient health and prevent further disabilities and early detection for any side effect and deal with it after the protocol of the treatment do. Standard 5E Prescriptive Authorities and Treatment. Psychiatric mental health nursing advice practice registered nurse uses prescriptive authority, procedures, referral, treatment, and therapies in accordance with state and federal law and regulation. Standard 5F Psychotherapy. The psychiatric mental health advanced practice registered nurse conducts individual, couple, group, and family in psychotherapy session using evidence-based psychotherapeutic framework and nurse-patient therapeutic relationship, and it is very important to deal with the patient in therapeutic way. Standard 5G Consultation. The psychiatric mental health advanced practice registered nurse provides consultation why to influence the identified plan, enhance the abilities of other clinicians to provide services for patient and effect change. Standards 5G and G are advanced practice intervention and may be performed only by psychiatric mental health advanced practice registered nurse. Standard 6 evaluation. The psychiatric mental health should be evaluate progress towards the expected outcome that put in the plan. The second biggest standards of professional performance, that is standard 7 quality of practice. Psychiatric mental health nursing systematically enhance the quality of effective of the nursing practice. Standard 8 education should be the nurse attend knowledge and competency that reflect current nursing practice and update herself. Standard 9 professional practice evaluation. The nurse evaluate one's own practice in relation to professional practice standards and guidelines, relevant status, rules, and regulation. Standard 10 collegiality. The psychiatric mental health nurse interact with and contributes to the professional development of peer and colleagues. Standard 11 collaboration. The nurse collaborates with patients, family, and the other in the conduct of nursing practice. Standard 12 ethics. Psychiatric mental health integrates ethical provisions in all area of practice with the patient, with the family, in the different area for providing health. Standard 13 research. Psychiatric mental health nurse integrated research finding into practice. Standard 14 resource utilization considers factors related to safety, effectiveness, cost, and impact on practice in the planning and delivery of nursing service. Standard 15 leadership. Psychiatric mental health nurse provides leadership in the professional practice setting and the profession. Now come and do some critical thinking questions about the previous lectures. We discuss the different parts in this lectures. We define the mental health and define the mental illness, and we mentioned the component of mental health, what is the factor affecting mental health, and also what is the characteristic of mental health and characteristic of mental illness, what is steps we can do to increase mental health or decrease mental health, and we discuss different standards for the nursing. I give you one questions to check your feedback. What personal characteristic do you have that indicate good mental health in you? You should be check yourself, and you mentioned what is the characteristic that you have to say I am mentally health person. Okay. Also, if you remember, what is the 5 axes that diagnoses the mental illness according the level. So with this point we arrive to the end of this lecture. Thank you, and thank you for your concentration, and I hope to meet you in soon in other lecture. Thank you.